Good evening. Not since World War II has this country been asked to give so much for its fellow countrymen, for the others on this planet, and yet that is what we are being asked to do. By this point, half of this country, more than half of this country, has been asked to stay home, to either telecommute or to not come into work at all. 37 states have closed all schools. We are looking at possibly nationwide curfews. At a minimum, a number of states, a couple of states have implemented statewide curfews. A number of cities have implemented curfews. And we're looking at possibly facing a national curfew. Donald Trump has come out and said that nobody should attend any gatherings of 10 people or more. A number of states have mandated that that there not be any gatherings of either 25 or more or 50 or more. Apple has closed all its retail stores until further notice. McDonald's, Starbucks, and Dunkin' Donuts are shutting down all dining services. You can still get drive-through, but you will not be able to dine there. And Uber is canceling all shared pickups. They will not be taking, you will not be able to split your fare by going with someone else. We're going to discuss some of the other things that have been happening. It's fortunately not been as crazy a day as it's been, but we're still taking a rather somber look at some of the data and the numbers. But there have been some interesting, sort of slightly more positive things. Facebook has decided it is going to give all employees $1,000. The IRS is moving taxes back 90 days. You will now have 90 days extra to file your taxes. And Universal Studios will be broadcasting all current movies. They will be streaming them so that you don't have to go to the movie theater, which in most cases you can't do anyway. My name is Lamar Soutter. Welcome to In Time. With me today is Courtney Stewart. Hi, Courtney. How are you?
I'm great. Well, I just learned all of that, really. You're the nose to the ground. I'm the commentator. But the movie theater is interesting because I'm really into movies. I'm a movie buff, so I'm glad to hear that. That's interesting. Where will they be streaming that? Do you know?
I don't know that, actually, and I don't know. I was under the impression that it was free, but I just realized I don't know for a fact that it's free, so I better not say that before somebody sits there and says, In Time is just making stuff up again. Again, I don't know what they're talking about. We don't make up stuff. And Stephen Colbert is broadcasting from his bathtub. No, I'm not making that up either, at any rate. I do think it was a joke, but so we did just look at the numbers right before. Okay, so the death, I do too. Colbert and John Oliver, who did, you sent me that John Oliver piece. He did, find that on YouTube. That's worth a while. We'll put a link to that. Remind me if I forget. No, correction, remind me when I forget. We will put a link to the John Oliver bit on the coronavirus. I thought he did a marvelous job. The coronavirus death toll is 8,000 people. But we're going to discuss why there's some cause for optimism and some cause for concern, obviously. A few other things that we do want to cover here. As of this moment, I keep wanting to say Tim Minchin. No, Stephen Mnuchin, the Treasury Secretary of the United States, has made several claims. First of all,
one and the same.
I try not to. They're indistinguishable, really. So
don't talk about Tim Minchin that way.
So Steve Mnuchin came out in a dance and started singing, and he was playing the piano, and he said, "Oh, wait a minute, no, I think I got that one wrong."
You got me.
Yeah, he said a number of things. First of all, we reported yesterday that a former Bush aide, followed by a former Obama aide, followed by Senator Mitt Romney, all came out and endorsed every American receiving $1,000 cash. The idea would be it was just a cash injection to try to help people who are having a hard time paying their bills and buying necessities, especially when somebody in the service industry. In fact, it's not going to be long before basically there isn't going to be any waiters or waitresses employed anywhere in this country, or I should say working in this country. They'll be employed ostensibly, but they'll be either laid off either be unemployed or they'll be just suspended temporarily. Who knows? And I think it'll be based on the business as to whether or not they'll be paying them. But even businesses can't afford to keep paying them forever without any form of income. So this would be ostensibly to help offset that at least a little bit. $1,000 isn't a lot, but it can mean a lot to people who are already who are just barely above water or just starting to go under. That idea has now been accepted by the White House, and they haven't said how much, but Mnuchin has said that they are endorsing the plan and that they plan on giving cash directly to Americans within 2 weeks. Every American, and then they qualified that if you're making $1 million, they may ignore you, which is one of the few sensible things I've heard out of this administration since it took office. At any rate, they announced that today. That is going to come out of a stimulus package now valued at $1 trillion that they're trying to push through Congress. The airline industry wants $50 billion, saying that this is going to hurt it far more than 9/11. That is probably true. 9/11, once the planes were back in the air, which was after a few days, there was some less travel, but travel wasn't prohibited. Basically, travel worldwide is down considerably. You can't get into the UK now unless you are a resident. You can't get into Canada unless you're a resident, and the US is about to implement similar restrictions. As I said earlier, 37 states now have closed all schools, and we saw something interesting. About 2 days ago, Boris Johnson was Boris Johnson, the Prime Minister of UK, was ignoring most of this and said, "Listen," and we had reported on this as well. Hey, it's diseases happen. Those of us who survive will be stronger for it. That's the argument I am not kidding. This guy was put into. Yeah, I don't know how he made it into office. If you've seen his hair too, but at any rate, of course, I'm one to talk, but still. He dramatically changed tone and is now suggesting that they may put the UK on lockdown. Trump has always been sort of iffy. You'll see where my head's at on that one. I greatly prefer Bush. No. Trump has been really very slow to consider this a problem, so much saying less than a week ago to Congress, or casually while at Congress, saying that everybody should ignore this and it'll go away. He's now saying that everyone should maintain a distance of, not be spending, not get in groups of larger than 10, and that he's going to be giving cash injections to the general population. I was rather curious as to what caused this change, and it turns out the change in both of them was caused by a single study, which was not published in a peer-reviewed journal. It was released publicly Monday by London's Imperial College. However, it was given to the White House Sunday night. In it, they said that if the course is not changed at this point, the UK can expect 250,000 deaths and overwhelming of the hospital system, incapable of not having enough beds or medical support for the people who need it, and that the US would experience well over 1 million deaths. This report was received by both governments, and it is at that point that Donald Trump and Boris Johnson started to change their tune. Donald Trump has unveiled a 15-day plan to really slow infections. The US is now also starting to ask nursing students, doctoral students, and people who have retired from either of those professions to volunteer to be placed on call, so that if the system starts to get overwhelmed, retired nurses and doctors can be called into service, and people who are studying but not yet qualified can be called into service. Yeah.
That's really interesting.
Yeah, that is a kind of an out-of-the-box move, and it's nice to see people thinking along those lines. I think it's not going to solve the bed problem. It's not going to solve the ICU problem, but it is going to do a lot, I think, and hope for the treatment problem. We had that discussion on the masks. Oh, yes, please.
Well, the money thing, that seems like it's going to make a lot of people vote for Trump.
You'd think I'd have thought of that, but no. That's no, I actually I had that that had not crossed my mind.
So tax season, you know, a lot of people have seen tax cuts as a result of this election. Even though we didn't think that it would hit people that were middle and lower class, but it seems like it slightly has, even if it's not good for the whole economy. But it's just that on an individual level, it seems like people are going to have this as evidence that Trump was a good idea and that he should be back in the White House again, which is
That's a good question.
scary.
There it is. That's an interesting point. I think right now he's received some blowback for how this has been handled, and my suspicion is he's going to receive a heck of a lot more coming up soon because he has failed to act on this in a timely manner. We have a slide. Actually, I'd like to bring up the slide. This is an interesting slide because this is, we talked about logarithmic growth. And this is an example of logarithmic growth. You can see here by this slide. Well, you can't see, Courtney, because you're on a phone, but everyone else can see. Well, I'm going to tell you what's on this slide, and you can. What you can do is just trust me that this is what the slide says. In time is the greatest place to work, and people 11 out of 10 hosts surveyed said that they enjoyed working at it in time. And yeah, wow, that's amazing.
Good to know.
Yeah, it's a coincidence. I don't know how that ended up in there. So what we have here is, if you take a look at the cases, what this has done is match up the numbers so that we've got some sort of concordance with where the U.S., Italy, and California are. The U.S. is about 10 days behind. You can see our numbers are from 314 are about where Italy was at 3.3. So that's the 10-day lag that we talked about earlier. Now, this is not a logarithmic, just sort of a linear growth. We're not adding a set amount each time. We're adding to the amount we're adding each time. And the problem is, especially in the U.S., we're not testing. So we don't know that how accurate these numbers are. We've got some idea, and it will get more accurate as time progresses. But there's good news and bad news on this. The bad news is that there's more people infected there by probably a significant margin than we know, because there's a reasonably high incubation period. So there are people out there right now who are infecting other people. That's why there's this isolation. So the numbers are going to get worse. The good news is none of this reflects the social distancing that we have started to undertake as of this moment. So the projections saying that if it goes unabated, we could lose. Now that study said over 1 million. The CDC projected 2 million Americans killed in about a 60 to 90-day period. I'm sorry. No, that's wrong. That was 2 million killed in 30 to 45-day period. If nothing is done about this, we have.
Wow.
Yeah, even though those are recent studies, they don't take into account the effect of the social distancing and the extreme measures that everybody has thus far been asked to take. That's why these measures are so important, because they can reduce those numbers and quite significantly, and they can keep the hospital system, hopefully, from being overwhelmed. We have a question: which countries have enough test kits to test whenever they want? I honestly don't know that. I know the U.S. is far behind the others. I know Italy has roughly caught up to it, and as I understand it, Italy can test anyone they want at any time they want. Right now, since everybody's on lockdown, that's almost a moot point. One of the goals of testing is to, aside from being able to treat somebody if you suspect they've got it, is to prevent having to do a lockdown, because you can isolate people that you know have it before it reaches that step. We may or may not have crossed that point. Trump, Mnuchin, and the head of the CDC have all said that this is going to get worse before it gets better. the governor of New York has said that at present, what they are looking at is if they don't arrest this, having less than half of the hospital beds that they need. And I don't have the mortality figures on that one, but New York is looking at a reasonably significant crisis if this isn't averted. Again, that's why we're doing what we're doing. These are steps to avert these kinds of numbers, and we're not going to know for at least a couple of days how effective they are. So, like I said, there is some good news. Facebook has stepped up to the plate by giving every employee $1,000. The tax day has been pushed back, and mortgage rates have been significantly reduced so people can get through this. I'm sorry, Courtney, was there something that...
No.
Oh, I wasn't sure if you were just representing.
No, I was... Bull sent me the, well, somebody sent me the the chart, so I was looking at the chart.
Oh, so you could look at the chart. Yeah. So Switzerland has also said that if coronavirus continues to spread at their current rate, the healthcare system will be overwhelmed before the end of the month. In other news, Joe Biden has won Illinois and Florida. Yes, the presidential race is still continuing. And Tom Brady has left the Patriots and is going to the Tampa Bay Buccaneers. Yeah, I care about as much as Courtney does about that one, but since I live in Massachusetts, I'm like required by law or something to freak out, I guess. So, oh no.
My dad's probably mad. He's from Mass as well.
Oh, okay, yeah. Oh, yeah. So then he's into football. So, but
Yeah.
there's been him and the Coach Belichick have been at each other's throats for a while. So, so I mean, I think the good news that the $1 billion package has to be by far the largest economic stimulus package I've ever heard of. They're concerned right now. Mnuchin has said that at present, if they don't pass some kind of package, they're looking at a minimum of a 20% unemployment rate. And that's once this is over. That's not, at this moment where unemployment is, depending on how you choose to measure it, going to be reasonably high. So I think that's sort of where we stand. It's nice to have a day where there isn't something completely urgent going on. The only other thing I can think of is Ohio canceled the primary. They were told they could not move it. So the governor said, okay, we're canceling it. And I think that was Ohio. Yeah. And so that's about where we are. So now you, Courtney, have been working from home for quite some time now. How are you doing? How's your family doing? How is everybody in your life?
Well, my sister, her restaurant is closed. She's a waitress in New York. And my parents both are still working because my dad works in a hospital. My mom cares for the elderly. And I have not really been affected that much. So I'm very lucky that I work in a job that I don't. I'm not making any less. I'm not working any less. I'm just working from home, and that's very fortunate. Unfortunately, actually, the nature of my work is much better and stronger in the field than over the phone. But I'm doing my best.
Now, I would assume in your field, how affected is it by the school closures?
Well, I guess it's just the kids that I see aren't in school. I know that local school districts here have offered meal plans, free meals for children within their district. I know Garland District ISD did that. So they're at a number of locations, they're giving out free breakfast and lunch for any child within that district. in Garland. So that's a very good program. They're also offering some like learning activities as well, but I don't know if they're going to continue doing that because they would have to go physically pick it up and get it, and that puts them more at risk as well. So it's much less risk than attending an entire school, but it's still, just as much risk as I would assume a restaurant, um, going and standing in line and picking up a bag and leaving. So they are looking at some online options to continue the school year. So I've been hearing that from parents that schools will be um, maybe continuing the rest of the entire year on online moving forward.
And that does remind me, and I've forgotten which, there is one state that has actually canceled the school year all the way through the rest of they've canceled school all the way through the rest of the year, which strikes me as a slight overreaction. But we have a question in the live chat because somebody's asking about the testing. So let's talk about the testing really quickly. South Korea has had some of the most successful testing programs there is, and South Korea has been able to largely arrest this because of that. South Korea has tested over 5,000 people per million. 5,000 per million that they've tested, and those are the ones that exhibit the symptoms and are most likely to have it. Italy is next below that, Austria, Australia, the UK, Czech Republic, Greece, and the US with less than 100. So this notion that the U.S. is, we've done almost no testing. We've done almost no testing. Trump said we've been testing regularly. He said that less than a week ago, and when he said that, we had tested 8 people that day. The idea that the U.S. is even remotely close to the rest of the world in testing is absolutely laughable, and while I appreciate hearing from our live chat and hearing people's opinions, if you think the U.S. is doing a good job, you are 100% demonstrably wrong. Not even close. Not even close. Google it. So the U.S. is far behind, and we are not capable at present of meeting the demand for testing. There are other countries that are meeting that demand, and in fact, South Korea has exceeded that demand. No, you're wrong. Sorry. At any rate, but please become a patron anyway. At any rate.
Join the information center.
I know, right? So I think that I'm glad it looks like this is going to be a reasonably short show. Like I said, Biden is continuing his role, and at this point, it's hard to imagine he is not going to be the nominee. Even if Sanders were to start picking up some wins, he's not going to have enough to overcome the superdelegate problem. So I don't see any way that it's going to be anyone but Biden at this point. So we're going to be looking at Biden versus Trump. There are at least one state has canceled the primaries. What that does, I don't know yet, and I'm not sure I assume all those delegates are released and become superdelegates. Yeah, and I think, honestly, I think that's probably the right call. I'm all for democracy, but at this point, if a judge is saying you can't move the date, then you're done. So unless we have any other questions from the live chat, I think we've just about covered it. I do think, we'll be back again tomorrow at this time to do an update. I'm really thrilled that we haven't had the kind of major updates today, with the exception of the $1 trillion bailout package and the ostensibly 20% unemployment rate, which is a problem. You heard about Trump's rating himself, though, right?
No.
That's the exact appropriate group intonation. Yeah, Trump was asked to rate on a scale of 1 to 10 his response in this crisis. And do you want to take a guess? do you really need to guess? Do you need to guess?
101%? Is that his guess?
Yeah, that's what I would have said too. No, 10. So at least he stayed in the realm of reality, which is unusual. That was a bold choice for Trump. Yeah, 10.
So what? 10 out of what?
10. 10.
10 out of 10?
10 out of 10 is his response. Somebody pointed out that he closed the what was it? The disease. I think it was the
Yeah.
disease rapid response. Yeah, he closed that, and he said, "Well, I didn't do it. Somebody in the administration did it. I don't know.
Right.
I just work here. I got no idea." It's like, uh,
He's like, oh, I don't know. And then he said like, oh, well, things happen, things close, people move jobs all the time. He's like, you probably worked somewhere else before now. Like, what are you talking about? Oh, God.
mistakes were made. Industries
But
got
no
shut
mistakes were made.
down. Yeah,
No,
God.
according to him,
That was
he's
that was
bloody
place.
perfect.
No, God. Oh yes, and he said supply is going to
Oh
continue to
no.
meet demand in this country, and he doesn't foresee any. For a businessman, he doesn't know much about economics.
Yeah. Or
He
making the
does know how
stock
to
market
lie.
plummet
Yeah.
with a
Oh, that.
comment
Yeah. So
about
the stock
trade
market.
with Europe.
Yes, we're halting all trade with you. Or no, 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 we're not. We're not. This is why
Yeah.
it pays to
We're
know
closing
what you're doing.
we're closing travel with Europe and closing all trade with Europe, and then stock market friggin' plummets, and
Yeah.
then he goes on Twitter like right after and he's like, no, trade won't be affected. It's like,
So now
no,
wait a
no,
minute.
don't listen to me. Oh,
You don't use
don't
Twitter,
listen to
right? Are you
anything I
saying
say.
it's good enough for the commander in chief of the U.S. military, and you're saying it's not good enough for you? Is that what you're saying? Who do you think you are?
To be on
Yeah,
Twitter?
she's unimpressed. Yeah,
To be
I use Twitter. I'm sitting there going like, I want to send Courtney a DM. Oh, I can't send her a DM because she's too good for Twitter.
uh, and I also don't know what the DM is, so cool. Um,
I don't
but
know her.
not on
Guys in the
Twitter.
live chat, I don't know. I've never met her before. All my
I'm
peeps
just not
on
on
Twitter, I
Twitter. I
don't
don't
know this
know.
person.
Well, okay. So I'm not on Twitter, Instagram, Snapchat, Reddit. I'm not on any of those things. So a lot of like, vernacular that's online, I don't know it. I don't have TikTok. I don't have uh whatever. I don't know. I don't know what I don't have. So many new things all the time. But
Oh, hold on. Oh, shoot.
I
Hold
just
on.
don't have the energy to keep track of it.
Oh, we have breaking news. The Secret Service has been sent to your door. They don't allow people who don't listen to social media. Sorry.
What?
I wonder how they got your address. I'm just saying. I gotta protect my Twitter
You
peeps
can't
from people who don't.
you can't dox me if I don't put my shit online.
Okay. Ooh.
So
Okay. I think. Bull. I think I just got outplayed on that one. I think I just lost. Shit. All right. Well, thank you all for joining us. I do think, yeah, according to Pence, the USA has 2 million. Yeah, well, according to the Trump administration, there's a lot of things. We may have those test kits. We're not using them. We are, and I don't think we have them. And Trump's passing most of this off to the states now, anyway. So basically, if the states are short ventilators, well, we'll get them to you, of course, because we're the federal government. But you try to get them first. Well, no, it's good to know if we have all those testing kits. It's good to know that it's not that we don't have them, it's that we're incompetent and can't use them. Good to know.
mm,
We don't have them because it cost $6,000, and you know how long it took to get the CDC to admit to, and I forget which congresswoman did that, to get the CDC. They cost $6,000 each. We don't have them. I don't care what Pence is saying. Pence is also saying, by the way, that the U.S. is not considering a national policy of curfew, despite the fact that the U.S. is considering a national policy of curfew. We know this because a number of people in those meetings at the White House are saying this. Not one person, not two people, at least three people, despite what Pence is saying. So I take everything Pence says with a couple Bibles full of salt. I take what Pence is saying with a Sodom and Gomorrah level of salt. That's how
oh
much salt.
no, that's so good. I like it. I like it.
Yeah. Oh, well, one more. Courtney and I were challenged to a debate today. Just saying.
Oh,
I said yes on her
in
behalf.
in more news. Oh my goodness.
Oh, God, I see this. That's what happens. All right. Well, thank you all for joining us. We will be back tomorrow, same time, to cover any new updates. And if there's anything really cray goes on, I mean, above and beyond what's been going on, national curfew or anything like that, I hate to say it, but at this point, it's like I don't want to jinx it, but frankly. So barring that, we will see you tomorrow just for another update. In the meantime, thank you all for watching, and we look forward to you tomorrow.